Hello, everybody. I'm so pleased that you're able to join us today. We are a wide range of individuals who are participating in this, from as far away as Bolivia and Peru, Washington State, California, a wide range of people on. So thank you so much for taking time in your busy day to meet with us, and for joining us for this very important dialogue on the pandemic and other threats to Indigenous peoples in the Amazonian rainforest. My name is Olivia Carter-Pokris. I'm a full professor epidemiology at the University of Maryland School of Public Health. And before we get started, I would like to remind everybody to please keep yourself on mute. To avoid the background noise, will make it easier for us to hear each other. I'd like to acknowledge the organizing committee for today's webinar: Haley Stewart, Dr. Ann Toomey from Pace University, Melissa Garcia, Bennett Ferris, and Dr. Andrea Addison from the University of Maryland, and of course, our wonderful speakers. Today is Indigenous Peoples Day in 15 states in the District of Columbia. In fact, this is the first year that my county, Montgomery County, has acknowledged Indigenous Peoples Day. At this time, we would like to acknowledge that every community owes its existence and strength to the generations before them around the world who contributed their hopes, dreams, and energy into making the history that led to this moment. Some were brought here against their will, some were drawn to migrate from their homes in hope of a better life, and some have lived on this land for more generations than can be counted. Truth and acknowledgement are critical in building mutual respect and connections across all barriers of heritage and difference. At the University of Maryland School of Public Health, we believe it's important to create dialogue to honor those that have been historically and systematically disenfranchised. So we acknowledge the truth that is often buried. We are on the ancestral lands of the Acai People, who are among the first in the Western Hemisphere. We're on indigenous land that was stolen from the Acai People by European colonists. We pay respects to Piscataway elders and ancestors. So please take a moment to consider the many legacies of violence, displacement, migration, and settlement that brings us together here today. At this time, I would like to share my slides. So this photograph I actually took a year ago when I visited with 11 students for the University of Maryland in the Bolivian Amazon. This area, this beautiful pass here, the photo was taken from San Miguel de Bala, where there are plans to build a mega dam. And so all this area will be completed flooded, and this is going to impact the communities that live around there. So today we're going to be talking not only about this threat, the threat of the pandemic, but also the environmental threats that are threatening Indigenous peoples in the Amazonian rainforest. Prior to the current pandemic, Indigenous peoples already faced entrenched inequality, stigmatization, and discrimination. Inadequate access to healthcare, clean water, and sanitation increases their vulnerability. Lapsed enforcement and environmental protection during the crisis has brought increasing encroachment on Indigenous peoples' territories by illegal miners and loggers. Realizing the rights of Indigenous peoples means ensuring their inclusion and participation in COVID-19 response and recovery strategies. These are words from the United Nations Secretary General in August of this year. Now we know certain parts of the world have been most impacted by the COVID pandemic. Latin America now accounts for 36% of average global deaths in terms of the pandemic. And in fact, according to the Financial Times, Latin America is the current epicenter of the pandemic, with the region accounting for more than 1 in 3 of all deaths each day. When we talk about the area that has been impacted, a lot of times we aren't really giving any time or effort to talk about what's happening in the Amazon region. The Amazon region covers many different countries. It covers parts of Bolivia, Brazil, Peru, Ecuador, Colombia, Venezuela, Guyana, Suriname, and French Guiana, many different countries. But of course, the ones that you hear about the most is probably Brazil. Today, we are bringing voices from individuals that we've had the great opportunity to work with over the last few years from both Bolivia and Peru, as well as in Brazil. Our speakers today include Ruth Alipaz-Kuki, Erika Elandia, Carlos Castillo Salgado, Guillermo Rodriguez Gomez, Michael Gerben, Thomas Hildy, Andrea Addison, Basilio Saurico, and Haley Stewart. If you would like to see their biographical sketches, please go to the webpage for this webinar and you will get all sorts of details about these individuals. So I would like to introduce Dr. Carlos Castillo Salgado. He's going to be talking about the impact of the pandemic within the Brazilian Amazonian region. So I'm going to stop my share. And so I will allow Dr. Carlos Castillo Salgado to show his slides. Please remember to hold your questions to the end of our presentation. You can use the chat box if there's an urgent question you would like to share, and so we can save it for that time. So please, Dr. Carlos Castillo Salgado, we look forward to your presentation.
Thank you very much, Olivia and the organizers. I will be talking a little bit about what is happening in monitoring COVID in the Brazilian Amazon. In the picture that you see is one very important survivor of the indigenous people, was a woman of 99 years of age that survived not only the COVID, but also the structures of the hospitals that are providing actually not very good care. I want to mention that Brazil, for many years, has been very interested in supporting the indigenous people and provide several agreements with different of their groups and tribes. And the Ministry of Health has a special department that is called CESAI. CESAI is a special unit or ministry in which provide the services for the indigenous groups. They are organized in 34 districts. As you could imagine, the Amazon in Brazil is very extensive and has thousands, actually almost 1 million of indigenous people. And then in the past, they were very active, this unit, in providing primary health care for these groups. As I indicated, there are 34 districts, and I will be providing some data from each of these districts. And this is very important also to let you know that this CESAI is integrated in the command centers of Brazil. Brazil is one of the countries that has a very useful operation of command centers across the country that is almost a continent. And many excellent epidemiologists have been working. However, most of these very highly trained professionals has been fired or forced to resign with the current administration. Because of this complexity, there are two main NGOs that are providing assistance to these indigenous groups, but also try to characterize the data, and you could access their website that I included in the transparency. I want to share the vision of one of the leaders, André Satere. This leader was very instrumental in informing two things, that because of the lack of treatment and adequate medications, they start exploring for some medications to address, actually, there is no cure for COVID, but there is some herbs or plants that support the control of the symptoms. And there is one, the ayahuasca, that has been very successfully in minimizing some of the symptoms. But another very important consideration that he shared with us is that the individuals that were providing the services for the indigenous groups in these health centers, they decided to treat some of them, but not to treat others. And they were creating a lot of confusion because there was no specific criteria why they select some to provide some treatment and why they reject the other ones. As you could know, there is a lot of problems, and this is the final letter of the National Assembly for the Resistance for the Indigenous in Brazil, and they were indicating that in addition to the medication and to the treatment for COVID, we need to also address the human rights and not only the specific treatment for COVID, because there is a lot of violations of the rights of the indigenous people. Here, I want to mention again that the most affected area of COVID in Brazil is the actually the Amazon state, in which Manaus is the capital. And here, you will see that most of the very avoidable mortality has been occurring there. And most of the vulnerable groups have been the indigenous people. Here, I gave you the information through yesterday. There is almost 36,000 cases that are confirmed, but with some of the official sources, but obviously not representing the true, because there is a lot of problems with the official data. There is almost 900 mortality, and 158 of their groups has been affected. All of this information you could have also access through the links that I included. There is a problem for many of the groups, since the hospitals for the most critical patients are days of the distance by boat. There is very much a major problem for getting the interventions that are needed for these groups if they become severe. I wanted to let you know why was entering COVID in the Brazilian Amazon. Actually, was because of one of the health providers. A physician that was infected was going there, and the first person that has been infected was a 20 years old girl from the Cocama tribe, and was infected by this physician that has COVID. Then was introduced by the health personnel of this institution of the indigenous group. And you see that it still is growing. And these are the two different data. One, the official, that is the CESAI, and the other is by this independent group that is also monitoring. I want to mention this is the tribe that had the first case of COVID in the Amazon, the Cocama, but also they provide a lot of cell interventions. For instance, they stop the entrance of any person that tried to enter to the tribe, and also provide the distancing, the mask, and for that, they were able to control the pandemic by their own interventions, not by the interventions from the government. They also indicated that the medication or the herbs that they had been using had been very relevant for their symptoms. Here is to illustrate that the majority of the cases are classified as no information. Means that they don't want to identify what is the tribe that has been affected. As could you imagine, in the first bar of this trend, we could see the majority of the tribes. The most important one is the non-information, and it's to let you know that there is a lot of unknown, and this was done by the specific declaration of the government to avoid the true information and the intensity of the transmission in this region. Here is the 34 groups or regions in which they are located. And I only present part of the information. I have some of my students that are also monitoring and doing the specific trend analysis in the most relevant tribes. As you could imagine, one of the very important considerations is that there is no access to proper care. The distances of the hospitals are very far. There are many other problems like malnourishment, anemia, obesity, and then that has been affecting some of these tribes. And there is a lot of data that is missing, but it's important to indicate that these NGOs try to also provide the most complete data. And here are some of the very important warning signals that are important. The first is the environmental changes that has been addressed by President Bolsonaro. The deforestation has been so much, particularly in the areas of the indigenous people. The increase of the illegal land and also the miners. See, in 2018, they were 4,000 and now it's 20,000. All of these people that are penetrating to the areas are illegal, but also they bring COVID to them. That's very important, as also Olivia was indicating. The United Nations are considering that all of these actions are being considering as genocide. And this is my last slide, is the mayor of Manaus that crying was indicating to the world that he indicated that there is a denouncement from them that this has been a genocide in the Amazon. And also the picture of all the affected Amazon with all the countries by the fires that has been neglected by the administration and the government. With this, I conclude that the very brief presentation of what we are doing in the monitoring of the COVID in the Brazilian Amazon.
Thank you so much, Dr. Carlos Castillo. If I could please ask everybody to put themselves on mute. It will be a whole lot easier for us to reduce background noise if we do that. And I also wanted to let you know that at the bottom of your screen, there's a chat box. So if there's a question you would like to raise of Dr. Carlos Castillo, Salgado, or any of the other presenters, please take advantage of that, because we're asking you to hold your questions until the end, so we would allow everybody opportunity to give their presentations. We plan to compile suggested follow-up activities and resources into a handout that will be posted on the webinar's website, as well as emailed to all registrants. So just as a quick reminder to please do that. Before we continue on, I just wanted to remind you that the Amazon River is the second longest river in the world, and the largest in terms of the size of its watershed, the number of tributaries, and the volume of water discharged into the sea. So it's not only important to countries in Latin America, it's important to the entire world. The Amazon and its tributaries flow through the countries of Peru, Bolivia, Venezuela, Colombia, Ecuador, and Brazil. And indigenous peoples, as you heard from Dr. Carlos Castillo Salgado's presentation, they inhabit a large portion of the Amazon rainforest. During our limited time today, we would like to initiate a dialogue regarding how COVID has changed the way that indigenous people in the Amazon region are currently living, as well as key challenges going forward, and identify strategies to assist during this unprecedented crisis. You just heard from Dr. Carlos Castillo Salgado about what's happening in Brazil, where they have some data. Now we're going to turn to countries where we don't have much data as to what the impact is. So I'd like to I'm going to share my slides again. Share screen. Okay. So just a reminder, in case you're not familiar about where Bolivia is a landlocked country. It's surrounded by other countries in Latin America. It does not have access to the sea. And the upper west is where you see the National Park Madidi. This is a bigger picture of the area that we're going to be talking about now with representatives from some of the communities there. San Jose de Uchipiones, for instance, is one of the communities where we're going to have a presenter speak in just a moment. I wanted to remind you that we do have a website that we posted in our chat box, Hidden Crisis in Bolivia, to talk about plans to build mega dams as well as environmental threats. And we've been continuing to update that to talk about what's happening in terms of the COVID pandemic and the impact is. So we encourage you to visit this website to learn a bit more about what's happening in this area. And now we're going to be turning to an interview that we did with Ruth Alipascuki. We're very happy that she's able to join us today, but we were worried about connectivity problems. And so because of that, we taped the interview in advance, and that's what we're going to show at this time. So let's see. So Haley, please let me know if you can see this on the screen. Can you see the video on the screen?
I can't see the video.
Okay, so I will have to stop share. Yeah, sometimes it makes you have to switch them. So sorry about that. Yeah. Okay, so now we're going to do this. Haley Stewart, do you want to introduce yourself before I show the video?
Sure. I'm Haley. Hi, everybody. I'm a filmmaker and a whitewater kayaker, like Olivia said. And then I think I actually gave a little bit of an introduction in this video, so we can probably just start rolling it.
Sounds great. Thank you.
Okay, thank you so much for joining us, Ruth. I've had the pleasure of working with Ruth for a documentary, Still River and Silent Jungle, about the local fight against the Chipete Bala mega dam proposals in the Bolivian Amazon. And just to give a little introduction for Ruth, Ruth Alipascuki is from the Chupiamona community and has been a completely pivotal figure in defending the region's indigenous rights. She's a leader in the local indigenous organization, the Commonwealth of the Beni River Basin Communities, and her organization, CONTIOCAB, which is dedicated to defending the indigenous rights and protected areas in the Bolivian Amazon. To start off, for the people who don't know much about the region, do you think you could please give a brief description of the Beni River region and the communities that live there?
Well, thank you, Haley. Thank you, Olivia, and for this space, virtual space where we can explain a little bit about communities, our communities. Well, our region is, we live in the Beni River Basin, and we always live there. And we depend on the rivers because the rivers could be our roads, because there is no other way to get from the communities or to the communities, for example, to go to the other cities like Rurrenabaque, where we go to sell our products. For example, the communities, Chamani and Onset communities, they produce plantain, vegetables, mandioca, that kind of products that they have for their lives, right? And that's their economic activities. For example, my community also, we as Chupiamonas, we work in the ecotourism, so we use the Beni River and the Tuichi River. The Onset Chimanes, they use the Kiki Bay and the Beni River. The Canas and other communities like Esejas also, they live in the Beni River. So 17 communities will live in this river. So river is our life, as you can say, as you can understand. And that's why it's so important that our region, why it's so important our territories, why it's so important the rivers to us.
What has happened since the onset of the pandemic in February?
Well, I can mention this as Indigenous peoples. We always knew that because
I think when you muted yourself, Dr. Carter Pocris, then you muted the video.
it was a shock.
Thank you
We
so
were
much.
not
I fixed that.
prepared. In a way, nobody was prepared. No government was prepared, and also the communities. So that forced us to just isolate us in the communities in our territories. So we were for around 4 months not getting contact with civilization in a way, and we were living there and just protecting us. And that situation, it is more critical right now because we're still in a quarantine that we cannot work normally. So no way to get some money to cover some basic necessities, to access some products that we used to buy in rural Navarre, for example, oil, medicines, soap to wash our bodies. So we have to cover some necessities, urgent necessities for the communities. And that's how we are right now.
Mm-hmm. Maybe you could give just a little bit of a background, the key threats to the region that have been there for the past few years, and then the key challenges that the communities are facing from now into the future.
Right. In 2015, the Bolivian government just decided to build two mega dams in the Beni River Basin. And so that was the huge threat to us, to our life, that's our existence. As I just mentioned, that the river is so important for us. So we really struggle to defend our territories, to defend our rights, because all the power of the state, all the power of the companies that were pushing these mega dams, and the 17 communities, we decided in 2016, in November, to make a vigil in the Bala stretch, where we were 12 days, and to stop to the companies. So we expulsed them in 2016. And right now, these mega dams still threatening us because the government we are in transition to change the government. So we are in alert, in a constant alert. We are in, I don't know, expecting maybe the worst, or maybe not, we don't know. So that's the situation right now.
I bet that puts even more pressure on the COVID situation as well. If they're defending against this project and then all of a sudden they have to find a completely different means of work and survival because of a pandemic. What are the communities wanting to do now? Like, how are they trying to adapt to the situation?
Well, this pandemic situation opened the territories and the protected areas, because our territories are also protected areas, belong Lajas from the Beni side and Mariri National Park from the La Paz side. What happened, it is more logging activities, illegal logging activities started again. And the mining activities, they didn't stop. And the hunting activities was because there is no money, there is no food to buy, so the people just started to hunt like a crazy. So the communities decided to protect the territory in the main entrance in the Suse, which is the main entrance to all the territories, with just our resources, right? But this is for the long term. Right now, for example, we need support, but the local government, they're not supporting us. No one is supporting us to do that, to protect the areas, our territories, our resources there. Well, this situation for us is just increasing the pressure, right? And we cannot it's not sustainable just to us to do it for the long term, because we don't have even for ourselves, and just to keep a group of people in the taking care of the territories, that's not sustainable right now for us. So that's why we think we need help, and the communities are thinking obviously to, even the scientists are saying that we have to make a regenerative agriculture. What we do, we always do that. So now we know that we have to produce more products as an economic reactivation. We also need seeds. We just got some seeds from vegetable seeds that's already in the territories. So we are looking for alternatives. I don't know, to create our lives or continue protecting also the territories, right? So yes, that's how we are trying to adapt to this new reality.
Thank you so much, Ruth, and thank you so much for all the work that you're doing. I'm excited to see how it unfolds in the future in the next few months.
Thank you, Haley. Thank you, Olivia, and I hope that everyone outside can understand the situation and try to help us in some way. Thank you.
Thank you for letting us show that very powerful video and for those words. Ruth, I know you're with us today, and I hope you're able to participate in our discussion towards the end. We're going to move now to Elandia, who's an eco-health researcher. She's a veterinarian, and we're going to show her video. Welcome, Elandia. Thank you so much for taking the time to meet with us and share about your experience. I understand you just returned from Medidi National Park and Pilon Lajas. It's been a while since you've been there. What were the changes that you observed?
Hi, Olivia. It's a pleasure to be here and to share my experiences in the area and what I saw there in the communities. Yes, I've been there for a week talking with people, with authorities. And I have to say that it's a pity, but COVID entered already in the region, even if there are no reports, no official reports. And when I went to the area in Rurrenabaque, which is the locality next to the indigenous communities, there in Rurrenabaque, every single person I talked with got the disease. So it was really like, oops, it seemed that it was complicated. Then I went, I've been talking also with some people from San Jose de Chupiamonas. There are not many people there, and I was surprised because usually they live, most of them, in Rurrenabaque, because this is the area where they actually the tourists, but there's no tourists at all in the region. And of course, the people from the communities who live on tourists left Rurrenabaque and they went back to their communities, to isolate themselves and their families from the disease that was pretty critical in Rurrenabaque. But it seems that at least in San Jose de Chupiamonas, there were no cases at the moment. Then I moved to Mopasa, Atacana indigenous community. When I was there were 2 people who died and 36 people sick that were reported by the health center. But it's important to mention that the health center is really limited in resources, but talking with people was almost the same situation as in Rurrenabaque. Most of them got the disease, not being reporting to the health center, and treating themselves with the natural plants, the medicinal plants, which is something that really helped a lot, according to what people was telling me.
Erika, you mentioned that there were no tourists. What are the challenges that ecotourism has essentially dried up? What are the challenges for that, as well as other challenges that you observed in the communities?
Well, for the challenges is really, especially in the communities along the river, well, even if it's nice that most people living in Rurrenabaque, for instance, left Rurrenabaque to go back to their communities, for many people this was great because it was an opportunity to meet their families, an opportunity to go back to the roots somehow, and to the way they used to live before going to the cities. There was people even from La Paz living in La Paz city and going back to their communities. It was great that they started harvesting, for instance, or preparing the soil, cropping to produce rice, cassava, plantain, since they realized how important it is to produce your own food. Many people, especially the young ones, forgot about start producing. They were buying everything in the cities. So this was interesting, but on the other side, it's challenging also because, for instance, in San Jose Uchupiamonas, I got to know that the number of families living there at the moment is the double that used to be last year. They used to be like around 60 families. Now there are like 120 families living there. So all the harvesting from last year are being reduced considerably to feed all these families. And this is becoming a big challenge for them. They start to work on the land again, but this production is not going to be seen until next year. So there's going to be probably a gap in food supply in November, December this year. And this is complicated for the people living normally in their communities. Another challenge is for the natural resources. There's going to be a big problem, I think, with the pressure, because the people living now in the communities, they are hunting, they are fishing, not only to feed their families and the rest of the families, but also to sell natural products to get some money, because tourism is not possible anymore. Tourism is really dead at the moment in Rurrenabaque, in the Madiri National Park and in Pilón Lajas. So people need money, they're used to use money, and natural resources are the ones who are going to be used to get that money. And I'm also a little bit afraid of the growing of illegal activities like mining in the natural areas, in the protected areas, and also drug production. I was surprised that coca leaf production is really increasing a lot in some Colono communities around the Madiri National Park and next to the indigenous territories. And it's money. So I'm afraid of these three aspects, the food supply, the pressure for natural resources, and the growing of the illegal activities.
And as an eco-health researcher, is there something else that you would like the broader world, the broader community to be aware of?
Well, I think it's important, and it's a big lesson, the importance of the local knowledge on health. In Tumopasa, it was really fantastic to see how people went back to use their natural plants, the medicinal plants, to solve a situation as critical as COVID could be. So it's important to give the importance to these plants, to this kind of treatments, to the knowledge of the old people, and to combine it. What they did in Tumopasa, combining Occidental medicines or knowledge with the local indigenous knowledge, was really what helped a lot to save some lives there. So I think that this is something important to keep in mind, that we need to keep promoting this kind of knowledge. And also something that was critical is from the health point of view, is that COVID took all the resources, all the attention of the authorities. And for instance, they suspect there are dengue cases in the area, but they don't know because it's not possible to test people. It's not possible to move, for people to move, to go to the hospital to take the sample. There's no money to do that. I mean, to pay for a doctor and the dengue test. And of course, there are other diseases that are increasing since there is no surveillance at the moment, because all the focus was COVID. All the resources were given to COVID. and this is critical and something that we need to to keep in mind. The neglected diseases, for instance, and the vector-borne diseases. Rain season is coming, and Zika, dengue, chikungunya, yellow fever are diseases that are common in tropical areas.
Thank you so much. I think that really covered the issues that we really wanted to hear, but we hope that you're going to be joining us on October 12th with the hope that we'll have connectivity, and so you could follow up with the discussion.
Thank you, Lydia. Nice to see you.
We're very pleased that Erika Elandia is indeed able to join us today. At this point, I just want to remind everybody that if you have any questions, please take advantage of the chat box. I know some people are just joining in. Don't forget to mute yourself to avoid the background noise. We're holding all questions until the end, so we allow our speakers an opportunity to present. Those speakers who were the furthest away, we've taped them in advance to make sure that they have an opportunity to share their remarks. So we're ready for you, Michael Gervin. Anything that you would like to add to the discussion you just heard?
Well, I'll just wait for the Q&A, but I think I'm glad that they went before me to give some preliminary background. All right, well, thanks. Before I begin, I'd just like to acknowledge the Chumash people, who are the traditional custodians of the land where my university, the University of California, Santa Barbara, resides. And I want to pay respects to the elders, both past and present, and other Indigenous people present. And I certainly want to thank the organizers for putting together such an important event, and grateful for the chance to talk with you today. So I've been very fortunate over the past 2 decades to have lived and worked alongside the Chamani, who you heard a little bit about from Ruth, who number about 16,000 strong in the lowland Beni region of central Bolivia. And the Chamani, they have a very rich understanding of the forest they inhabit. They're skilled farmers, fishers, hunters, collectors. All of their housing materials comes from the forest. They are expert navigators of the Maniqui River and surrounding tributaries. And they have a beautiful language that's pretty much unrelated to any other language in Bolivia. And so my first visit was in 1999, and a few years later helped set up the Chamani Health and Life History Project, which is designed to improve health and well-being amongst the Chamani and surrounding Mosatan populations, while also learning about aging and the role of pathogens in affecting our immune systems in a context very different from, say, the big cities of Latin America and the US and abroad. And so, like many other indigenous populations in the Amazon, the Chamani are no stranger to disease and infection, especially those brought in from outsiders. And while the Chamani do suffer from higher rates of respiratory infections and other infections than surrounding populations, it's important to remember, right, that health is more than just a diagnosis from a physician. The Chamani are very social. They have large, close families, rich, extended kin networks that provide a lot of meaning and purpose to life. And though the Chamani are familiar with tuberculosis, pneumonias, diarrheas, intestinal worms, etc., they're mostly free of hypertension, obesity, diabetes, heart disease, and Alzheimer's disease. So when thinking about how COVID-19 could affect the Chamani, there's the usual discourse about vulnerability. Certainly indigenous communities in Bolivia weren't part of any organized regional or national treatment plan. Their high rates of respiratory illness, potentially compromised immune function could put the Chamani at higher risk. But it's important to remember here that everyone in the world is vulnerable to COVID-19, right? So it's new. No one has automatic immunity. Plus, with the emphasis on vulnerability, we often forget that groups like the Chamani are very resilient. Their ability to produce their own food through subsistence activities, both in terms of the know-how, but also having use rights in their native territory, makes it easier for them to self-isolate and reduce the kinds of exposures that might otherwise come from needing to go to town and make a living. Tribal sovereignty also allows the Chamani to make their own decisions, especially when it comes to restricting access to their communities. So in March, our project, we shut down usual relations, and after lots of conversations with Chamani government, municipal authorities, and our own multinational team, we shifted gears to try and confront the pandemic. And at the time, information on the ground was very limited or confusing, contradictory. Many in the Beni didn't really take COVID-19 so seriously until it really hit the Beni capital of Trinidad, and then the more local town of San Borja some weeks later. So early on, together with tribal leaders, including the current health minister for the Chamani government, who worked with us over a decade, and the amazing Chamani on our team and the Bolivian physicians who've worked on our team, we tried to come up with a culturally appropriate plan, first to get folks informed and prepared, and then to try to act once COVID hit the region. And that first part went pretty well, visiting about 60 villages for awareness campaigns, sharing knowledge in town hall meetings, using materials like the CDC posters translated into the Chamani language, radio messages in Chamani language. And the decision of the Chamani leadership and from many village leaders was unanimous. Basically, collective isolation would be the best defense against COVID-19. You probably heard that in many different tribes around the world, and for quarantining suspected cases. And in every village, concern and plans for the oldest members was discussed, that elders would live out maybe in their fields or in the proximity of their fields away from lots of other people, would be kind of one plan. And so COVID hit the Beni by about mid-April, San Borja by about early June, and then many Chamani set up barricades on dirt roads. They were monitoring the river in case merchants or other outsiders were coming through. They tried to protect their elders through physical separation. And this lasted about a few weeks, maybe, because as you can imagine, these kinds of initiatives are difficult to sustain. So by early July, we heard about the first COVID case amongst the Chamani, possibly coming from a child's birthday party, although it was probably brought in from Chamani who often frequent town for official government meetings. And then pretty soon other cases popped up in a lot of other villages. Luckily, we were able to get a bunch of rapid antigen tests from some Belgian colleagues. And so we were able to help confirm diagnoses for suspect cases, monitor health status, and do some limited contact tracing. We had some pulse oximeters for monitoring oxygen saturation in the blood. And we bought some portable oxygen delivery systems in La Paz for the emergency cases, basically. But before long, as you heard Ruth and Erica talking about, our worst fears came to pass. The infection spread across many of the villages located near San Borja. In at least 30 villages, we counted lots of cases, confirmed cases. In a few villages, up to 70% seem to have been exposed to the virus. And by September, the more remote villages located really downstream or further upstream from San Borja also had exposed to the virus. And during this period, we were working with a bunch of other physicians local to the area, maintaining communication through WhatsApp, through phones, just trying to monitor the spread and at the very least provide treatment where needed and keep tabs on the sickest individuals. So we're still kind of working through the details, but as far as we've been able to tell, the effects of COVID actually have not been terribly severe in the Chamani territory. A couple cases did require some oxygen and hospitalization, but these were mostly Chamani who lived largely in town. Many Chamani we talked to actually considered it just another gripe, like another type of flu, and they reported using a wide range of local plant remedies to get better. Village celebrations still occurred in a number of large villages. They were canceled in others. And by our estimates, the first wave, at least, of the pandemic seems to be on its wane, although it's a bit rough, but the Chamani seem to have fared comparably well. And as far as we can tell, only one death may be attributed to COVID. We just hope there's not, of course, any new surprises waiting around the corner. But hopefully, one thing I want to end on, there might be some opportunity. Why have the Chamani with COVID recovered without many of the complications that we hear about elsewhere? Are there lessons to learn that could help others? First of all, the relative absence of some of the comorbidities that spell disaster for countries like the US and the UK is probably a big help. As I mentioned, very minimal diabetes, obesity, and heart disease. But like it's been suggested in other parts of the world where severity also seems to be more minimal, it's possible that the Chamani have prior exposure to related coronaviruses that might give them partial immunity. Another possibility is that some of their diverse exposures to many different types of pathogens over their lives, especially chronic infections like roundworm and hookworm, might actually help regulate their immune systems and prevent the kind of dangerous inflammation, the so-called cytokine storms, that seems to be so lethal in many other places. So we're going to continue trying to work together with Chamani leadership and village leaders and local authorities to just help to navigate through this pandemic while recognizing that all the other usual health problems haven't gone away, right? So the emphasis on COVID, I mean, all the other morbidities are still there. And that's actually been the biggest kind of tragedy, is the lack of attention to all the problems that people have on a daily basis. So thank you very much for your time and attention, and I hope to dialogue in the Q&A.
Thank you so much for providing such a succinct update. I shared in the chat box that we had posted a link to your Lancet article about the protocol that had been developed. So if anybody wants to access more details about the protocol you were describing, I encourage you to take a link to that. And we're going to be updating the list of resources and sending out to all participants after this webinar is over and we have an opportunity to process the information. At this point, I would like to now turn to Haley Stewart. Haley, would you like me to load up that first webinar? I mean, the first video?
Sure, yeah, here, I'll just give like a tiny introduction for it.
Sounds good.
Great, and thank you all speakers who've already spoken, who are about to speak too. It's wonderful to meet those of you who I haven't met yet and hear your words. And I just want to say it really means a lot to gather these voices here today. And as you are now all aware, I'm working on a documentary to raise awareness about the Chipete Bala mega dam proposals, which threaten to flood the Beni River Basin in Bolivia, including the two national parks, Madidi National Park and Pilon Lajas Indigenous Reserve. And we're almost done with our short film, which we will be releasing in film festivals soon, hopefully, and using as a proof of concept for our eventual feature-length documentary on the issue, which we will be posting updates about on our website, hiddencrisisbolivia.org, which is posted in that little chat. So Olivia is about to show you two videos. The first one is the trailer for our short film, featuring our speaker here today, Ruth Alipas Kuki, and who is at the forefront of this fight to defend the Beni River Basin communities, and is actually our main character for the documentary. And the second video that you're going to see is a short 1-minute video for our fundraising campaign for these same communities. As Ruth mentioned, her community and the surrounding villages have been heavily impacted by the pandemic, and that's just on top of the pre-existing threats in the region of illegal mining, logging, poaching, and 2 huge mega dams on top. So I really want to encourage everyone here today, everyone who's come here to learn about and help support Indigenous communities. If you haven't already donated, please do. We're trying to reach our goal of $25,000 by October 31st. And every single dollar here donated really helps. And this money is going directly to the communities themselves to ensure their sustenance and survival in the next year and beyond. So if you have donated already, thank you so much from the bottom of our hearts. And if you still need help finding that link, just follow the link that's going to be in the fundraising video that you're about to see. And you can also visit our website, hiddencrisisbolivia.com, and you can also go to gofundme.com and type in help Amazonian communities weather the pandemic. So thank you. Olivia, you can show the videos now.
So Haley, which video would you like me to show first? The documentary?
Why don't you show the trailer first?
Okay, I'm going to show the trailer first. And I did want to make a point. We have reached out to other organizations. Unfortunately, just like with other fundraising events, oftentimes the funders are extremely restrictive as to how you can use the funding. For instance, Rainforest Trust, which is a great organization, they're currently providing COVID funding support, but only to current projects. So even though Sidiria Lodge and Chalalan had received support from Rainforest Trust in the past, they're not eligible, the communities are not eligible for the funding at this point. So that's the reason why we have created a separate fundraiser. And so it's just going to take a couple of minutes to show you the documentary. If you see an opportunity to show the larger film, to sort of stimulate some discussions at your organization, please let us know. And I'm sure Haley would be very happy to organize something once it gets ready. So I'm going to now share my screen.
En tiempos inmemoriales se erigieron montañas, se desplazaron ríos, se formaron lagos. Nuestra Amazonía, nuestro Chaco, nuestro altiplano y nuestros llanos y valles se cubrieron de verdores y flores.
Estamos hablando, al frente de ustedes está el Parque Nacional Mariri, el más biodiverso del planeta. Esto es la reserva de biosfera Pilón Lajas. Esto va a ser inundado. 2 ríos van a ser.
Poblamos esta sagrada madre tierra con rostros diferentes y comprendimos desde entonces la pluralidad vigente en todas las cosas y nuestra diversidad como seres y culturas.
Teníamos un sueño para adelante, tener una zona turística.
Dejamos en el pasado el Estado colonial republicano y neoliberal. No está.
Cualquier persona, cualquier defender puede defender. Estamos ejerciendo un derecho a la defensa al estar aquí presentes acá.
Un Estado basado en el respeto e igualdad entre todos.
Pero estamos a tiempo de evitar eso, de evitar que ocurra el desastre. Yo no tengo miedo.
Thank you for your patience while we shared that video. Again, a much longer documentary is going to be available in the next few months. And if you're interested in sharing it with another organization, please feel free to contact Haley Stewart, and I'm sure she can make arrangements to organize something in the future, or at least to let you know when it's going to become available. So, at this time, I would like to now.
Sorry, Olivia, if that was that link that you just started playing, if that's the link you're about to show, I think that's the wrong link.
No, it wasn't, it automatically rolled over. So I'm going to share a different link. Yep.
Okay, good. Yep. Just making sure.
Good. So at this point, this is the short video that we prepared for the fundraiser. And again, we'll put a link, and if this is not something that moves you to donate, that's okay. Perhaps you know somebody else who might be moved to donate, and even sharing it would be really helpful. This is one of the things that unfortunately Bolivia and Peru have not gotten the attention that some of the other Amazonian countries have received. And so that's why we're bringing it up at this particular point in time. So at this point, I'm going to share the video. Thank you for your patience while we shared that. Anything else that you want to say, Haley, at this point?
Just that I'm about to share a link to the donation page in the chat box.
Great. All right. So at this point, we are going to be switching countries and we're going to be going to Peru. So let me pull up my slide because I just want to, just in case there wasn't a map, I wanted to share a map. So as you can see, when we look at Peru, Peru actually has more than one location where you can view the Amazon, Iquitos and Tambopata. And we are going to have at least a couple of presenters who are going to be presenting different aspects. University of Maryland has short-term study abroad programs to the Bolivian Amazon and also the Peruvian Amazon. And so all three study abroad directors are participating in developing this webinar. So we appreciate your participation. So at this point, I would like to turn to Dr. Andrea Odison. And would you like me to share the video at this time, or would you like to give some remarks initially? I'm sorry, we can't hear you.
Okay, unmuting.
Yes.
So yeah, I'd like to just introduce, well, myself, I have run for the past 10 years out of the University of Maryland, medicinal plants of the Peruvian Amazon, and sometimes we include the Andes. I've had a lot of mentors that have made this possible, and many of them are from Peru, and that's who you'll be hearing from in just a moment. Other mentors have been medicinal plant researchers, chemists, doctors and pharmacists, and all of us have gone down to these different sites in Madre de Dios and Iquitos for maybe the last 20 years. And everyone has learned from the speaker you're going to hear from in just a moment, and that's Basilio Saurico. He's from a community just outside of Iquitos in the north. I can actually show a slide with that map too if you want, but and he knows the forest like the back of his hand. He's a river person. His mother is from the Kokama tribe down there. Another one of our collaborators is part Watito and Okaina, and there's a lot of Shipibo folks in the area as well. But we'll be hearing from Basilio, who had to paddle 2 hours to get to secondary school when he was growing up, wanted to be a forest engineer, but didn't have the opportunities, and sort of moved into ecotourism, became a guide, first a musician, learned English. And so that's been the capacity that he's been able to teach all of us for so many years. And he is so proud of the biology of that forest. He just can't wait to share it with all of us. So that's just a brief introduction to Basilio, and then you'll hear from him directly right now.
Great, thank you so much. I'm going to share my screen now.
Has the forest become more in danger now that people are needing to use it to live?
The situation in the jungle has always been very, everybody's concern. It's our concern, it's your concern, the whole world concerned to protect this. We see in the area which is into Peru and our country and the Amazon part of Peru, there's not much like a big investment in terms of a plantation of something. The only thing the local people do, they clear small areas, which is, I'm sure you understand what is slash and burn. It's still the same way to farm here as always been. There's no changes since I know my way around, slash and burn. But those are small places, and typically near to the river. So then there's no one that I know living any way into the jungle doing this kind of farming. It's not. Maybe a little bit, but not much. Good thing there's a lot we can do in terms to preserve the rainforest for the whole world, not only for Peru.
Yes. So would you say that the indigenous communities were affected by the pandemic differently than other Peruvians?
Well, the key, they always say, was the economy. There are many people, they couldn't quarantine for all. The food was the very, very important thing of that. So people did try the best. They tried the best to provide people food, basically, and small cash for that. Some of us, we have some saving. We could buy food from that without getting any pay, any salaries. It's difficult, but we survived. Same thing, the people in the countryside. I think I'm sure they need cash as well. But I think they were a little different than us. I think they were more able to get their own food right there on the river, because they were not supposed to go out. I'm sure they done it because they need it. There's many people in Peru as well. People don't have a full-time. They got to go on the street to work daily, and we're talking about a big amount. That was a problem too. So they say we cannot be in quarantine. We cannot be locked at home. We got to go out, because one day we don't work, we don't eat. That's what they used to say, literally speaking. Yeah, that was the case. But I think in general, it affects us in that way, economically. Of course, many people lost their family members as well, that kind of pain. But the economy was still not any good. But it's improving. At least people not much concerned about they're gonna get the virus and die.
You have taken us to villages many times, the students that have come from the University of Maryland, and we have been welcomed into people's homes, and they've shared stories about their life and how they live with us. Do you think that we would be welcome again in villages, or if that might not happen for quite a while?
Personally, I think so. I think people will never change about visitors. There's always been the case here. It is sure it's not the economy is not based on tourism in Iquitos, but in other parts of Peru, it's like Cusco. But here, but visitors, I think, will be always welcome to any village to visit. And many of those families, they know us, they know me. Oh, they're always welcome tourists wherever they come from. I don't think they change it. I don't think that changes at all. I should say. I can say that almost sure. We're welcome.
Oh, good. So is there anything that you would want the world to know about what's going on in your particular area that you would want to share?
Well, I would love to share this part of my country with the visitors from all over the world. You have to be part of it. And the only way to know how this jungle is, the real jungle is, you got to visit. This message goes to all of you and the whole world. We don't own the jungle, or Brazil, or other countries. It's the whole world. So the only way to preserve it, participation for everyone. There's so much to learn. So many things going on here in this jungle, and there are many things. There might even be maybe the heal for many diseases in the whole world. So we don't know. We're still studying that. There's many things we don't know what they are. There might be the cure for many things that the world is suffering from. So you got part of it. You have to be part of it. You have to come. You are invited to come here, to Peru, through Brazil. Doesn't matter, as long as the Amazon jungle, the one of the world. It's an invitation for everyone. I love to share with you my country, Peru. Anyway, thank you.
Thank you so much for your patience while we viewed that video. I'm gonna make sure that it doesn't do that. At this time, I want to check in with our last study abroad director, Tom Hilde. Did you have anything that you would add that is similar or different from what you heard already that you heard from your friends and colleagues from Tambopata and beyond?
So I'm a research professor in the School of Public Policy, and I have, for the last 10 years, been spending chunks of each year in Madre de Dios in the Tambopata region, which is across, on the Peru side, across the border from Bolivia, which Ruth and Erica and others have been discussing. The situation is strikingly similar. So I'll highlight a few things and then try to do so briefly so we can have we can go to discussion. But the indigenous group I'm discussing here is the Acai People, and there are three Acai communities. The largest is called Infierno, then there's Palma Real on the border with Bolivia, and Sonene on the border with Bolivia. And COVID entered roughly on the same timeline as Michael was talking about, I believe. There are just some of the facts here. There have been 5 deaths total in the 3 communities, 3 in Infierno. Unfortunately, well, they're each unfortunate, but unfortunately the first death was Don Ignacio Duri, who was an elder, ayahuasquero, a shaman, and one of the most important people in the community. It has mostly affected people over 60 years old. And what I hear on the ground is an estimate that probably about 40%, maybe 50% have been infected with COVID. But the death rate is quite low, and that's quite remarkable. They did not have immediate access to modern medicine, so they were using plants as well. I'm not sure of which plants. I'm sure one of them is uña de gato, which is used for immunity issues in general. But it was clear that many people were getting sick. So we made a couple efforts. I didn't launch these, but I participated. One was done by Wildlife Messengers along with the Macaw Project to raise some money to send supplies, information on the disease. A little later, the community of Infierno, the native community of Infierno, converted the community center, classrooms in the community center, to a clinic for the elderly. So some of the money went to buy mattresses, oxygen tanks, balloons, oxygen balloons, what they call oxygen balloons. So there are supplies coming in, mostly not from the government. And they've shared among the 3 communities. So Infierno said, we've got enough. And so we're going to share with the other communities in the area. They've done a brilliant job of that. But again, one of the key things is the economy. Infierno in particular is highly dependent on tourism, ecotourism. They own or co-own a couple eco lodges that are, one of which is quite famous now. This is one of the most biodiverse places on the planet. So, that economy has simply collapsed. So the largest source of revenue has collapsed. This is a worldwide phenomenon for areas that are dependent upon tourism, but it particularly hits hard here. So now the most immediate concern is really getting food to people. Elderly people can't quite do farming, and it's not like you plant and you harvest in a week. Anyway, so this means meat, like chicken, things like this, other kinds of supplies. And so right now, I can share this later. There's a site that you can go to contribute to donations for food and other types of things. But I want to, so I agree with what Ruth and Erica were saying. These are similar cases on the Peru side as well. But I also want to reemphasize what Michael said. These are vulnerable people, and there are all kinds of threats. Mining is the largest threat in this area, and the byproduct of mining, mercury poisoning in the rivers. And that is one of the long-term problems of the indigenous communities in this region. But at the same time, they're very resilient people. We've been seeing their organization on the ground, their efforts, and then this very low death rate is quite remarkable. So I think along with Michael, there's a lot we have to learn from them. And I look forward to doing that.
Thank you so much for your comments. At this point, we're moving to discussion. It seems like this has just been so packed, but we recognize people have limited time span right now, especially with all of the demands that we have with the pandemic. So I'm going to turn to a colleague of mine who I've seen has posted a lot of questions. Jim Gaudino, can you ask just one question of all your questions? You've posted so many. One question that you would last at the speaker. I know that's tough. You have so many questions. We can share them with the speakers afterwards.
Absolutely. Thank you, Olivia. My question is related to these are different cultures all along the Amazon, I would imagine. I'm not an expert. I don't know, and I've never been. Sounds like I should. But what have you heard if oral tradition stories about experience with epidemics, outbreaks, and disease pandemics from these communities that possibly they're using to help them, be resilient and survive?
Is there anybody in particular you want to address that question to, or just open to everybody?
Open to everybody.
Okay.
Can I say something about?
Please, Ruth, please do.
Well, I was to Dr. Tom Heider. He was saying that at the same time, these communities are very resilient. That's true, but when we are being poisoned by mercury, I don't think that would be that we can resist that, right? And we are resilient when the natural process is happening in our environment. We know how to face, for example, we know that we went through other pandemic situation in the past, and we react as now we react, and that's isolation. That's going very into our territories to protect ourselves. That Erica was saying, that's a phenomenon, for example, and the people who are living in cities or small cities, they go back to the territory. That's our reaction when something like that happens. And then we use the natural medicine. For example, you were mentioning uña de gato, but we also use, for example, in my community, we use the quina, and many other plants. And we have also our chamans in our communities. So we use all this kind of knowledge to protect ourselves. But now are different times. Someone was commenting, I think you were commenting too, and this, we went through now more in contact with the Occidental culture. So we depend more from the products that they've been producing in the cities or industrial products. So that's why we are more dependent to buy, and we need more money, and we need to have medical supplies, and but because people were, one thing is what's happening even in the cities, that people were getting sick but couldn't go to the hospital for other sick, they were ill, but I don't know, but they were not receiving any attention, medical attention, even because all was COVID and no other different illness. So I think, we depend more on the other different kind of products, and we are, I don't know, vulnerable. So when we feel vulnerable, we went there, but and Erica says also, no, food was for, I don't know, for their 50 families in the communities, but then 130 families, and they consume more resources, more food in the communities, and the medicine that we used to have also. So yeah, that's the situation. I don't know if I responded. Thank you.
Thank you so much, Ruth. That was very eloquently said. I just wanted to let people know in the chat, Michael Gerben has responded to a couple of questions, so you may want to read this. Again, we're going to be sharing resources as well as a recording after this webinar is over, and we'll make sure not only is it posted on the website, but we'll also send you a note to let you know via email to let you know that we've done so. At this point, the organizers have a question for all the participants, all the speakers. After hearing these other perspectives, and for many of you, it's the first time you've had an opportunity to meet each other, what opportunities are there for collaboration or sharing? I'm putting that out to all of our speakers as well as our participants. What opportunities are there for collaboration and sharing?
Thank you for this is Carlos for a very important question. I think there was an idea like 20 years ago from the different authorities, but also representatives from the different tribes across the Amazon to develop the trans-Amazonic surveillance system. That was supported by an economic agreement that was very important, and that was for 10 countries. Unfortunately, the current president in Brazil has been dismantling all this very important initiative. I think with the technology that is available and the availability with even a phone will be very important, and the support of the NGOs to collect relevant information about the survival, because one very important consideration that we had seen is that the mortality rate in the indigenous people is lower than the usual mortality. And this is perhaps of some lack of the preconditions, but also perhaps is the lack of data, that we don't know if actually the mortality is higher. Then we need to do more research, but not academic research. I think we need to have operational research that will be done to support better interventions, because we need to recognize that in addition to COVID, all of the presenters recognize that there are many other conditions that are still there and are not being addressed adequately. With even influenza, Zika, yellow fever, and dengue, that is my main concern for the Amazon. We need to join forces in providing what interventions could be done. And we did in Colombia something called Caminantes de la Salud, that they are a new way of community surveillance, that all these leaders become sentinel epidemiologists that provide a better information for the community, but also what type of interventions that they can be done independent of the regular official health system.
Thank you so much, Dr. Carlos Castillo Salgado. Anybody else want to weigh in? What are opportunities for collaboration or sharing that might have occurred to you as you heard the presenters?
I have one thing that's just very practical, specifically with Erica and Ruth, given that we work in adjacent areas, partially overlapping areas of Bolivia, just sharing resources and knowledge about different protocols for testing, even shuttling samples, potentially analyze some samples for if it's helpful for confirming positive cases and for sharing resources, oxygen availability and that kind of stuff. It's pretty hard to get now in Bolivia. We had to do a bit of work to get those originally. And so since we have already a network, a team, it might be helpful, especially because we actually work in the Pilo and Lajas area, but haven't been able to go there more recently during this pandemic. And so, yeah, it might actually be very helpful and fruitful to just share knowledge and networks. And so, yeah.
Erika, did you have any thoughts about potential for collaboration?
Yes, definitely. I mean, well, this is the important thing when working with a One Health approach. I mean, it's really important to collaborate, to talk to each other, and at the different levels. We have academic people working one side, but also and especially working with the indigenous communities, the protected area, the responsible or the rangers from the protected areas, who are the ones who have been able to visit the communities during the pandemic. Yeah, they were almost the only ones being able to visit the communities. So one thing that we are trying to do, and that's why I went to the communities 2 weeks ago, was to check how the situation is, if it was possible to start working. And what we want to do, for instance, and we are also very worried about dengue, Zika, chikungunya, yellow fever, we had some cases in Bolivia for 3 years now in the north of La Paz department. So what we want to do is somehow what Carlos Castillo was talking about, is to implement community-based surveillance systems. So train people and learn with them also how to identify the kind of mosquitoes present in the area, to check if the Aedes aegypti, for instance, is present there, who is the transmitter, the one transmitting many of the dangerous diseases transmitted by mosquitoes, and so that they can be aware of what is happening and be the one taking the decision on what to do to face this situation. And what the experience of Michael with the Chamani communities is really important. We were chatting in the meantime about sharing experience with the LAMP test they are implementing or planning to implement in the San Borja area, because diagnosis is the most complicated problem in the area, because there's no access to the area. People need to leave their communities to go to Rurrenabaque or San Buenaventura localities, and you need money to do that, you need time to do that, and even when going there, sometimes the diagnostics tests are not available. So we're trying to use technique like the LAMP technique to try to detect COVID, but do it in the community, so without a laboratory, and a specific laboratory. And we're working with the Stanford University, who are developing some toys. I call them toys because they are based on toys, but for instance, a centrifuge so that you can run the test without electricity. And this is going to be very useful to any indigenous communities in the Amazon, where electricity, for instance, is not available. So sharing the experiences, the knowledge that all the people who has been in the panel and maybe in the public now is going to be really important, so that we can help people to improve the health situation, to face these and other problems that they live with, like dengue, leptospirosis, and other neglected diseases.
Thank you so much, Erika. I am going to give the very tough task to Anne Toomey and Melissa Garcia to do a final wrap up. We've had so many issues that were discussed in a really short period of time. Again, we are going to be posting the resources on our website, and we're going to let you know via email when they're available, as well as the recording. So Anne, take it away, real short. What are the key points that were made, and future activities we can do?
Okay, thanks so much, Olivia, and everyone. I'll just start by saying my name's Anne Toomey. I'm an assistant professor in the Department of Environmental Studies and Science at Pace University. and whose campus and surroundings in downtown Manhattan occupy the traditional lands of the Lenape people. So I'd like to start by just honoring this day and issues discussed in the webinar by acknowledging the occupation of this land from its original inhabitants who cared and thrived on that land where I now work and live. So my colleague, Melissa Garcia, and I have been taking some notes, and we're just gonna share a few key points that these conversations brought up. So first, I'll just say that I think the presentations today have pointed out the importance of thinking about the legacies of Indigenous communities, not just in the past and the present, but also in the future, about their survival in current environmental, social, health challenges in the world today, and also the importance of the role of Indigenous communities in shaping the world and how we might think differently about a post-COVID world. Melissa?
I think we also need to think about the continued injustices that Indigenous communities face. It is clear that national, even local governments are neglecting to care for Indigenous peoples in remote areas. The COVID pandemic has highlighted the disparities in care and continued lack of health and environmental justice in terms of Indigenous peoples, as highlighted by Carlos Castillo Salgado. Also, the lack of transparency by the governments. It's also important that we be aware of the threats to Indigenous lands, which include miners, colonizers, expansions of agriculture frontiers, loggings, fires, the mega dams that Ruth Alipas mentioned, and the uncertainty posed by the pandemic, and also in terms of changing political conditions.
And at the same time, the presentations really pointed to the importance of Indigenous resilience. So for example, a few presentations talked about the importance of traditional medicine, control over their own lands, returning from more urban communities to rural communities. So this idea of going back to roots, seeing family, friends, engaging in traditional activities, such as planting and harvesting, but also to remember that these communities are part of this larger global system. So it's not just a matter of just going back to one's lands, but there's a need for local, national, global assistance. And some of the speakers pointed out the increases of numbers of people living in these communities, and in some cases doubled. So concern of lack of food, increases in the amount of hunting and fishing pressure, not just for subsistence, but for selling to have other sources of income, as other previous sources of income, such as tourism and other activities, have disappeared. And how these concerns are increasing as the rainy season is upon us.
It is so important also that we recognize the need for resources in all of these communities, including testing, access to hospitals, income, and perhaps even more importantly, access to land and resources to continue traditional uses and important practices. If self-isolation and the repracticing of traditional livelihoods is one of the best forms of defense against COVID, as pointed out, then how can government support Indigenous communities in this? And how can we remember that the Amazon is for all of us, and it is our global responsibility to protect it and the people who live there and who have lived there for countless generations. And so this is why the efforts of everyone here, everyone who's participated in this webinar, is so important, and to know that this is not a short-term crisis caused by the pandemic, but it is long-term and needs to be sustained.
So those were our few notes that we put together, and just thanks to you, Olivia, and I'll give it back to you.
Thank you, everybody, for your patience. I know we're 4 minutes over, but I greatly appreciate you staying, because I think that was very important to do a wrap up. And I hope this is the beginning of a dialogue and being able to collaborate, working together on these issues. Please look forward to receiving the email to let you know when the additional resources are going to be posted. Those of you who are speakers and others, please share those resources so we can include it in the handout, and the recording will be available. Thank you again, and I hope you have a great evening.